All right, so we're here, another great podcast today. We're with this Dr. Jesse Jutkowitz with the ABC Miracles, which is Advanced BioStructural Correction for the body with Riley down below. And Dr. Jesse, welcome to the podcast, and thank you so much for your time today.
Oh, well, it's a pleasure to be here.
So, really fascinating science on a body alignment. I know that you called in and we were talking, and Riley right now is having some issues, and you've got like a course and information that's based on sort of biostructural alignment. Give us a little information about what that is, what it works, and what it's all about?
All right. Well, a lot of people have been to a chiropractor, and what you hear about chiropractors, and a lot of times you hear it about the same one, is, they're great. They saved my life. And then other people, well, I don't know if it really did anything. And then some people, oh my God, the person almost killed me. Right. And you hear that about the same people with different others and things. And the reason is that the basis off which chiropractic works is just completely inadequate to create any sort of consistent or predictable results from what they do. And I went through chiropractic school. The story the story's it's a bit longer, but I didn't really know anything about chiropractic when I went. And I went, and the freshmen, the first class in, they're the fodder for the junior clinic. They're the people the junior clinic works on before they work on the public people, so that they get some explanation. And the guy took X-rays and he measured things out, and he was talking to me, and I swear he might as well have been talking Greek. I didn't understand anything, of course, but I didn't know anything either. And he lays me down on my side, gets his hand on my atlas, that first vertebrae up there, and whacks it as hard as he can. Besides scaring the living daylights out of me, I got up and I felt really weird. And I couldn't figure out what was going on. And about 2 hours later, I realized my stomach didn't hurt. Now, I've had this stomach pain since I was born. I can never remember not having stomach pain. Little kid, big kid, whatever. I couldn't, and this thing was gone. And I went and ate the spiciest food I could find, which always set me off. Nothing. What goes in hot comes out hot. I had that, but otherwise nothing. And then I ate the greasiest food I could find, which set me off, and nothing with that. I was like, wow, this is fantastic. So the first semester is all medical stuff. People don't realize chiropractors get the same basic medical education that medical doctors get. It's just they go off into using drugs and other things, and chiros go off using manipulation. And then when we got to the second semester, when they started talking about the manipulation stuff, I have an engineering background. It's not schooled. I developed it myself. It's a whole story. I went to Purdue. I was not in the engineering program, but I used to do everybody's engineering homework for them and all this other stuff. Um, but the guy said things that if the things he said were true, I would be sitting on a pile of rubble now. There's no way you could make a building with the mechanics they talk about. For the easiest example is this guy said one of the first thing he said is if you put your hand behind somebody and push down on them, and then if you lay them down on their belly and push down on their back, it's going to create the same effect. And I said, wait a second. I said, I was always like, this was in Minnesota, and I was the loudmouth guy from New York, who's always willing to talk. I said, wait a second. I said, if are you saying if I go out in the parking lot and I push on my car from behind and then I push on my car from in front, it's going to go in the same direction? And the guy said, bodies are different. And I said to my friend, I said, Charlie, stand up. And my friend very laughingly said, no, don't get me involved. But he stood up. I pushed his body that way and it went that way. I pushed his body this way and it went this way. I looked at the guy and I said, no, it's not. And he said, I'll talk to you later. And the short story is he was standing up on this lectern, and I walked up at the end of the class. He looked down at me and he said, don't you ever do that to me again, and walked out. And then I started asking chiropractors and others about all this stuff. And I found out that manipulation works wonderfully when it works, but nobody really understood what was going on. And so I went on the same search that just about every chiropractor goes on, trying to find the most effective method. I came across a thing called spinal column stressology, which was this chiropractor Lowell Ward had gotten together with a friend of his who was an aeronautical engineer, Clint Fulkerson. And they started putting things together, and it was mostly Clint Fulkerson with the engineering approach, but they started figuring out things that other people hadn't figured out. And then I came along and I had both backgrounds, the chiropractic background and the engineering background. And I was able to put it together and basically finish what was started. And so if you use Advanced BioStructural Correction, which is exactly what it says, it's an advance in body structure correction that is beyond what anybody believes can really happen. You get the results that osteopaths, chiropractors, bone setters, and all these other people doing manipulation, you can get them consistently and predictably. All right. So that's that's the big introduction and the basis of what we're talking about here. All right. And you know how everybody says to have good posture, you have to use your muscles and hold yourself up.
Hmm.
Okay. It's not true. All right. Riley, would you like to have your shoulders not slump forward in about 10 minutes?
You're
All right. Okay.
Yes,
All right.
absolutely.
All right. If people go on my website, abcmiracles.com, one of the things that's on there is there's a free video to teach you how to do what's called the first rib maneuver. All right.
Hmm.
So what happens is when your first rib, and you have two of them, all right, when your first rib falls forward, you have no muscle or combination of muscles that can pull in the direction needed to have that go back into place. All right. So Sean, if you want to have yours go back too, you're both sitting there and you see how my shoulders are out and back and I'm
Mhm.
relaxed. All right. In a couple of minutes, your shoulders are going to be more out and back than they were. Okay. Yeah. See, that doesn't work because you have to do something and hold it there. All right. All right. So, if you would stand up and give us a side view of your body, or even sitting, give us a side view of your body. Yeah, give us a side view. All right. Put your hair to the other side so people can see. All right. And look straight ahead and let your body just relax and slump. All right. So you see where your shoulders go?
Hmm.
All right, Sean, you want to do this too, or you just want to
I'm
watch?
going to let Riley do it because she's more photogenic, and I'm kind of like stuck in a little cubby area here.
Okay. All right. So you notice how your shoulders roll forward and all that? Okay.
Yeah.
So, all right. So face the camera. So, no, totally
Oh,
face the camera. All right. So let's start with your right side. Put your right hand flat on the right side of your chest with your palm down on your pec. Just put your palm down. All right. Now turn it so your middle and index finger, okay, are on the front of your collarbone, right where it attaches to your sternum. A little bit higher and a little bit more medial, a little bit toward the middle. Feel that big lump there?
hmm.
You want to be on that big lump, right on the front of it.
Okay.
Right? Now you want to push that up and back with your fingers as
Oh,
hard as you can. Yeah. Push it up and back with you. Now you want to put the pad of your underneath your thumb, it's called the thenar eminence of your other hand. All
okay.
right. Now, leave those fingers a little bit higher. All right. Now take
Okay.
your other hand and put your other hand up like this. All
Okay.
right. And put this part of your hand on the fingernails. All right. Now,
Okay.
what you're going to do is with your right hand, you're going to push up and back as hard as you can. And with the left hand, you're going to go back like this and you're going to hit your fingernails as hard as you can to drive that first rib, which is behind the clavicle. All right. You're going to drive that upward and backward as hard as you can.
So just hit myself?
Yeah, don't go that far
Well,
away because you're going to miss. Just a little and hard as you can.
okay.
And don't hit your hand, hit through it like you're trying to hit the wall behind you. Hard. There you go. Now switch hands and do the other side.
Okay.
Oh, I didn't have you breathe. I should have had you breathe beforehand. Now push it up and back
Wait.
and hit it. Go ahead, get your other hand up there.
Okay. And then
Move it a little bit to the side, a little bit sideways. There you go, on that big lump. All right,
yeah,
put it
I can
up
feel
and back.
it. Okay.
And with this thing under your thumb,
Okay.
all right, turn your hand a little sideways like you're doing a karate chop.
Yeah.
There you go. And hit it as hard as you can.
Ow.
There you go. All right. Okay. Now
Okay.
that actually felt better than the other side did, right?
Yeah.
Because you didn't give the other side a good thump. All right. All right. Put your hair around the other side and turn sideways. And get a little bit more sideways to the camera. There you go. See, now immediately if you go back to the video, you'll see your shoulders don't slump anywhere near as far forward.
Oh.
Right? Now you see if you let your body slump now. See, it doesn't go anywhere. You notice that?
It's not.
Oh.
It's
Yeah.
not.
Now we didn't have you breathe, but if you take a deep breath,
John, you need to try that.
Yeah, I
yeah,
do.
I think the most like when I pushed on it originally, like that was the main, like I felt everything like coming together. That was interesting.
yeah, yeah. So what happens? See, take a deep breath now. You notice get a much deeper breath than you usually do, and you notice your chest fills up a lot easier than usual. So you're when I said take a deep breath, you're getting ready to take this big, hard, deep breath, and
Yeah.
it almost immediately goes right up, right? Now
Yeah.
you're hitting down, Sean. Yeah, you have
I,
to do
I'll
you
do
have
it
to do it
after.
exactly right.
I'll do it after the call.
Yeah, there's a video. It's about a 15-20 minute video on the website. It says learn the first rib maneuver free, and it'll teach you how to do it really well. It's see now if you look, just sit back and let your body relax. See now if people run the podcast backward and look at you before,
It's actually true.
they'll see you were sitting there like this.
And I have like severe, severe, severe pain in my back right now. And I need to actually go get it taken care of. And that definitely just helped.
I was going to say, you notice it's not hurting as much?
Yeah, that actually really helped when I sat down. It took some of the pressure off of my like the bottom of my spine.
That's right. And the reason is, all right, and this is there's a medical researcher. He was in the 50s, 60s, and up to the 80s. I think he died in the early 90s or late 80s, whatever. His name was Alf Breg. He was a neurosurgeon, and he wrote Adverse Mechanical Tension in the Central Nervous System. And he discovered, and that book, a lot of people think it's a neurological text about neurology and stuff, and it is, but it's more a engineering text about the mechanics of the body. And people don't realize your brain and spinal cord, as well as the meninges, which are the coverings of the brain and spinal cord, act like a big rubber band from your tailbone all the way up and around your skull. All right. So one of the reasons you got so much relief from what we just did is because your body was curved forward like this.
Mhm.
And if you think about it, when you curve forward like this, just like if I hold my shirt tight, it stretches from the top to the bottom. So your upper body is so far forward that it's pulling on your lower back. And I wouldn't be surprised if your lower back has almost nothing to do with what's going on with your pain. All right.
Wow.
Now, I would tell you a bunch of other things to do, but the big discovery, and this is the big one, all right? Everybody knows bones go out of place. Chiropractors talk about it all the time. Medical doctors talk about it. Osteopaths talk about it, and they're all right, okay? However, until I came along, and it always sounds arrogant because I'm talking about me, until I came along, nobody ever wrote down or discovered that you could divide bones out of place into two categories. One is bones that go out of place in a direction your body just self-corrects because it's got muscles pulling in the direction needed. That happens to everybody dozens of times a day, all the time. You can't move your shoulder without your body going out of place and then pulling the bones back into position. A lot of people don't realize the only way your arm is attached skeletally to your body is right here at the collarbone. All right. The rest of it just floats on muscles. All right. So that happens all the time. Then you have bones that go out of place in a direction your body cannot self-correct because there's no muscle or combination of muscles that can pull in the direction needed to reposition them. Now, I just showed you the first rib one. All right. When that first rib, and you have one on each side, of course, when that first rib falls forward, you've got no muscle or combination of muscles that can pull and get that bone back into position. All right. And if you get somebody else to learn the first rib maneuver and do it on you, because they'll have leverage to do it from the outside, that'll go much farther back, and that will stay back more than you imagine. All right. And so that'll be, and you should take pictures before and after because the changes are huge. All right. And one of the main reasons I did that to start is because if people go on my website, the ABC Miracles website, they will see a lot of pictures of people before they're slumped and then after they're standing straight. And a lot of those people are in the same clothing. And the reason is that's because it's before and after the first visit, and they are truly letting their body slump. All right. I let my body slump and it doesn't come forward, sort of like yours now. But yours, that's just the first rib. If we do the rest, your body will be up and square like a model. All right. You know how models try and hold themselves up all the time? Well, if you get treated this way, whether you're a man or a woman, doesn't matter. Your body will stay upright like that all by itself. Right. So the big secret is bones go out of place in a direction your body cannot self-correct because there's no muscle or combination of muscles that pull in the direction needed to reposition that bone. Now, like I said, I just showed you about the first rib, but if I show you about, let's talk about the spine because it's easy for people to understand. All right, this happens in your legs, it happens with your ribs, it happens in a lot of places. But the spine's easy to talk about because people can visualize it and they're used to looking at it. So if you look at somebody's spine, if one of those bones goes to the left or to the right, you've got muscles on the side that attach from the vertebra, from the spinal bone, to the ribs on either side, and you can pull it into place. Same thing with rotation. All right, you got muscles that go from the ribs, from one bone to the other. You could pull it back into place. Now, if one of those bones goes backward, you actually have muscles in the front, like the diaphragm and other muscles, that attach from the front of the vertebra to the back of the ribs. Okay, and then down lower, you have the psoas, which goes from the front of the vertebrae through the pelvis and attaches to your legs. You can't stand up without pulling your entire lower spine forward. So if one of those bones goes out of place left or right or backward, you can self-correct that you've got bones that pull in the direction needed. If one of your spinal bones goes forward, okay, what do you have back here that can pull that way?
Nothing.
That's right. There's nothing that goes, they call it the backbone because it's the backbone, right? You have nothing that goes from the bone from a spinal bone to something stable behind the spinal bone that can pull it back. Now, if you tell this to a chiropractor or a lot of medical doctors or other people, they say, oh, you could just lean backward and that'll bring the bone back. But that sounds wonderful. But like a lot of engineering things, it doesn't work that way. Because if you have the two bones like this, all right, when you lean backward, both of them move. So they both go like this, and then they go back into position, and you end up in the same position you're in. So it doesn't work. All right, their assumption is the bottom bone is stable, and it can just lean back and slide back, but the bottom bone's not stable. All right, so the entire, you almost never see people leaning backward. Okay. You almost always see people that are collapsing forward. And the reason is forward is the direction when a vertebra goes out of place, okay, or the ribs also. When they go out of place, that's the direction. You can't pull them back, all right? There's no muscle or combination of muscles that can pull in the direction needed to get those things back. So when that happens, your body starts to collapse, All right, you lose bone leverage. You know how people talk about all this muscle memory and this and that and everything else? That's all a bunch of hooey. All right, what it is the bones are stuck out of place, and you can't do anything to change that. Now, as soon as you get somebody else to do it, actually, the first rib maneuver is one of the only things you can do on yourself that actually creates a decent change. But, all right, you can get a 5-year-old or a 10-year-old to do that first rib maneuver on you, all right, and it'll work better than you could do it on yourself in 100 years. I'm the guy who figured it out, and I can't do it on myself anywhere near as well as I can teach you to do it on me in about 5 minutes.
Mm-hmm.
All right. It's bones out of place that your body can't self-correct because there's no muscle or combination of muscles that can pull in the direction needed. All right. Now, you would be astonished to understand how many doctors actually believe that muscles can pull bones in every direction. So that's a bunch of baloney. And I know because I've had them tell me this. Right. Now, there's another problem. And the other problem is bones that are out of place in a direction your body can self-correct because it does have muscles pulling in the direction needed, but then your body doesn't correct them. Right? Everybody's got that. All right. So you've got bones out of place that the body can't self-correct because there's no muscle pulling in the direction needed. And you have bones out of place in a direction the body can self-correct, but doesn't. Why would the body leave them out of place if it has muscles that can pull them back in place? What do you think? People talk about weak nerves and weak muscles, and they talk about all this stuff. But they've been talking about that since the time of the Greeks and before. All right. And now we have electric stimulators from nerves and muscles, and they should compensate, and that should fix it. But it doesn't. And the reason it doesn't is because the bones that are out of place that the body can self-correct but doesn't are being left out of place because they're part of the compensation pattern. All right. So something goes out of place that your body can't self-correct, and you lose bone leverage, and it creates imbalances there. And so you twist and bend and do whatever you can do. You don't have any, when a vertebrae goes forward, for example, you don't have any muscles that can pull the vertebrae back, but you do have muscles that can pull in other directions. So you twist it, you turn it, you tilt it, you do whatever you can to try and stabilize that area. Now, if you think about it, that creates yet another misalignment. And then elsewhere, you have to compensate for that. And that creates another one, and elsewhere. So you never have something that goes out of place in a direction the body can't self-correct and a compensation. You have a whole pattern, and it goes throughout your body. All right. If you look at the the ABC logo, it's got a stick figure, and it starts out all twisted up, even the arms and legs. And then as it gets corrected, everything straightens out. Well, that's more literally true than you would imagine. All right. You can't affect any one part of your body without affecting every other part. Okay. Like you guys are sitting there, right? So without doing anything, just sit same place. All right. And breathe in and out through your nose. All right. You notice your nasal passages, how open or closed they are?
Mm-hmm.
All right. Now, without moving anything else, just scrunch up your toes in your shoes. Now, holding your toes scrunched, now breathe in and out through your nose. Yeah, see, it's different. You can even see it over the thing. You can let go of your toes. So you're sitting. Your toes are not even in the weight-bearing chain. Okay? You're sitting, but when you scrunch them up, it affects how your nasal passages are open or closed. So everything affects everything, and you can't get away from that. Yesterday, somebody said, well, my chiropractor talked about doing local adjusting. And I said, yeah, there is no such thing. All right. They adjust your knee, it affects your whole body. They adjust your elbow, it affects your whole body. You can't not, pardon the double negative here, you can't not affect the entire body. All right. Now, so if you don't differentiate between bones that are out of place that the body cannot self-correct and bones that are out of place that the body can self-correct but doesn't, you're in a big mess. because if you straighten out the ones that are part of the compensation pattern, all right, you ruin the compensation pattern, and the ones they're compensating for go out of place a little bit farther and get worse. That's why a lot of times you hear, well, the chiropractor kept me going for just so long, and then I finally had to get surgery. All right. Well, they kept working on the compensations instead of the things that are out of place that the body can't self-correct, and the body kept resetting it. Right? You might hear from an osteopath or a chiropractor, that manipulation, or a chiropractor, that adjustment didn't hold. Well, why didn't it hold? Well, the muscles are weak, the da. They tell you nutrition. They tell you it's all a bunch of baloney. The reason the reason the bone went back into place or back out of place, all right, is it's part of the compensation pattern, and the body had to reset that compensation in order to not fall over. And when I say fall over, I mean literally fall over. Okay. And so that's one big problem with looking at bones that are out of place that the body can self-correct but doesn't. All right. There's another problem with that. Because the bones that are out of place that your body can't self-correct can't be self-corrected. All right. Your body can't leave the weight or the mechanical stress on those areas, because it'll literally knock you over and take you out of action. Right? The people who get stuck so far forward that they can't compensate end up in the hospital. It's astonishing. Excuse me. But you'd be astonished. You could go into the hospital with a big rolled up pad, okay, and lean people backward over the pad, correcting vertebrae and other things that are anterior, okay, and you'll empty out about a third of the hospital, right? All these people with COPD, you know what that is? Chronic obstructive pulmonary disorder. You know, they can't breathe well.
Right.
All right. They're taking all these medications and everything. It's not a medical problem. It's a mechanical problem. Your chest shape has changed. All right. And they have the research on this is all medical. It's if you go, they started in the 1960s. They had straight back syndrome, and what would happen is when your spine gets pushed in, and when the curves that you're supposed to have in the back, you're supposed to, from the side view, your neck goes like this, and then your back goes like this, and then your lumbar spine curves the other way. All right. Well, starting even in the 60s, they did research. When the spine flattened out from front to back, it changed the chest shape, and it affected the way your heart pumped. All right. Did you notice that your face sort of flushed after you did that maneuver?
Yeah. My face has flushed.
That's right. Now, the reason is before you were over like this, and your chest was compressing your heart and lungs. Right? When your first rib goes forward, not only do your shoulders roll in, but the top 1/3 of your chest collapses on the middle 1/3, which is where the major part of your lungs are and where your heart is. All right. So as much as you're breathing better, your heart is functioning better because your heart's in there and your chest is collapsed. And your heart is probably pumping just fine. Okay. But with the collapse, it can't open up. It opens up by elastic. It pumps by muscle power, but it opens up by elastic. So you did the first rib maneuver and your body popped up a bit. All right. And immediately your heart can now open up and pump more blood per beat. And people don't realize how important this is until you put numbers to it. Because an ounce of liquid is what, 2.5 tablespoons? Not very much. So if this opens up and your heart can take in 2.5 tablespoons, which is 1 ounce of blood more, and it beats 72 beats per minute, all right, that's 72 ounces of blood pumping one extra time every minute, or 72 ounces of blood more pumping every minute. All right. Now, the average body has 5 quarts of blood, all right, which is 160 ounces. So 2 times 72 is 144 plus a little bit. So every 2.5, 2.25 minutes, your entire blood volume is circulating one extra time. Plus, you're breathing that much better and getting that much more oxygen in. All right. I'm sorry to say I ruined some guys. Some guy was doing this deep breathing class for his people. And one of his people came to me and I treated her. And you just did that little first rib maneuver and it wasn't very effective because you can't do it yourself anywhere near as well as somebody else. But you get treated this way and your breathing changes. I mean, we've had people on a spirometer where we've had their breathing change 20 or 30%. Okay. We have, it's actually funny. Sometimes you go to a gym and they measure your vital capacity. And so they have you take this deep breath and they blow, you blow into a spirometer. Okay. And a lot of people have between 60 and 80%. All right. You treat somebody with advanced biostructural correction and you put them on that spirometer and their vital capacity measurements will be 105 to 110%, depending upon whether I've eaten or not, because food takes up room down there. All right. My vital capacity is 118% to 105%. All right. And this is very consistent across the board. All right. I had somebody not too long ago, was a new client, and I treated them 3 times and they said, "Can I go to the gym?" And I said, "Yeah." And they, the personal trainer did this vital capacity testing. And, she took a deep breath and blew in. And he was like, "Oh my God, I can't believe it." And she told me about it. I wasn't there. And she said, "What do you mean?" She thought it was something bad. And he said, "You've got 99% of your vital capacity. Nobody's got 99% of the vital capacity. The highest I've seen is 85%. And she told him about me, and whether he ever comes in or not, I don't know, right? But that's there. Now, back to bones out of place that the body cannot self-correct because there's no muscle pulling in the direction needed. All right. The bones that go out of place as part of the compensation pattern are where you hurt. Okay. So like your low back, Riley, has probably got nothing to do with what's going on with your body. All right. It's the effect end of your upper body being stuck, and it's where your body can shift the weight to. All right. So places where you have degeneration and places where you have pain or anything like that are almost always compensation pattern places. All right. And when they go to where the pain is and they try and get the bones back in place, and oh, you feel a lot better. And then half the time before you walk out to the car or after you're in the car for 5 minutes, you hurt again. And that's because your body has to reset that compensation pattern. Otherwise, you're really going to collapse and have a problem. All right. One of the easiest ways to know if somebody helped you is you stand there and you take a deep breath and you let it out and notice how much effort you take. And then you have the person work on you. A massage therapist, a chiropractor, an osteopath, a personal trainer, whatever it is. Okay. Then afterward, you stand in the same place. You never know how the floors are. And you go, and if it takes more effort for you to breathe, they messed you up. All right. They made your mechanics worse. And there's no exceptions to this. Everybody says, "Well, yeah, but there's not always." No, there's no exceptions. All right. I don't know if you've thought about it. Okay. And this sounds really arrogant, but if you take your car to the garage, do they have a choice in what they need to do to fix your car?
Not
What do
really.
you think? Not really. They gotta follow the exact right diagnostic thing, and they gotta fix things exactly right, or it's not going to work. Okay. People think they have a choice. Oh, this guy's a good mechanic. Well, this guy's a good mechanic because he follows the directions.
Mhm.
Well, in order to fix your body, there's really only one way that works. And the way that works is you find, and you're not fixing it, cancer, infections, or fractures, or diabetes, or something like that with body structure. Okay. All these people that say if you get your body structure right, everything will work and all this other stuff. And, the chiropractors say, oh, we're working with the nerves. It's all a bunch of hooey. All right. If body structure works, then everything else will work mechanically. But that doesn't mean chemically you're going to be okay. And that doesn't mean you're going to be able to fight off infections and things like that. Yes, it'll work better. But if you got a big infection, don't come to me to straighten your body out. Get the antibiotics, get the bugs killed, and then if you have body problems, we'll straighten out your body problems. That's it's and as far as other things go, you guys have ozone and the frequencies and stuff like that. You know about that stuff, all right? But that's a whole other thing. I always laugh these people who have Rife machines and other frequencies that they think are going to help various muscle problems and bone problems. All right. And not so much. Okay. And the reason is, unless it corrects the structure, it's not going to correct the structure. All right. So that happens. Not to say that the wavelengths and all this other stuff don't make everything better. They obviously do. Otherwise, you guys wouldn't be in business. All right. It obviously works better. Okay. But once you get the bones and everything aligned, it works phenomenally better. We actually have a lot of acupuncturists who learn ABC because it's part of their license. They have a lot of people don't realize acupuncturists are actually not acupuncturists. They're Asian medicine people. In China, they call it TCM, which is traditional Chinese medicine. And it's got three branches. It's got the acupuncture with the needles. It's got the herbs and all this stuff, everything from moxibustion to taking herbs, all that stuff. And it's got what they call Tui Na, which in Chinese is push-pull, which is manipulation, right? And the interesting thing is, when I found this thing where bones go out of place in the direction the body can't self-correct because there's no muscles pulling in the direction needed, I thought it was the stupidest thing in the world because I thought, well, that's no big discovery. Every idiot knows this. And I started talking to my patients about it. And they thought, oh, I didn't realize that. I thought your body could move in every direction. All right. And then I had the big realization, which was what do chiropractors and osteopaths and everybody else do? They lay you down on your back and they push down on your spine. Well, think about it. That's the one direction your body can't self-correct. All right. Now, if they get lucky, they change your compensation pattern, and where it was pushing on and hurting is different. So you can make somebody worse mechanically by 10 or 15%, and that'll change their mechanical stress pattern and take the pressure off one area and mess up some other area, and they will perceive they're better. All right. Now, that doesn't say that people don't sometimes get lucky and make people better also. That happens too. But with ABC, it's consistent and predictable. You can predict what's going to happen. Now, as the person gets better, it's a different process than people talk about. All right? Because if you think about it, the spine is the easiest thing to talk about, so we'll talk about that, but it happens in your legs and your ribs and other areas. But if one of these bones goes forward in your spine, you lose bone leverage and you start to collapse. So you don't like that. So you don't have any muscles that can pull it back, but you do have muscles that can pull in other directions, like I said. So you twist it, you turn it, you tilt it, and you do whatever to try and stabilize that area and compensate. You come along to an ABC practitioner, right? If Riley stands up now, she'll tell you she's actually feeling more stable than she did before. Because when these bones start to line up, even just the first rib, you're actually more stable. So if you're more stable, remember the reason this thing twisted was because you were unstable. So if you're more stable, this thing starts to untwist. And the more your ABC practitioner corrects, okay, the more stable your body is, and the more these things can untwist. All right? Now, when your body's all twisted up, it's literally like a big rubber band. All right? Twisting a rubber band. And, people say, well, a rubber band can go all the way around. Your body can't. The answer is not so fast. It's another one of these engineering things that people don't really understand. Because if as your body starts to twist around, all right, when the vertebrae lock up because of the way the joints are, all right, you can't keep twisting, but you can kink to the other side. And so you kink to the other side, and then your body twists in whatever other direction it goes. And so it's very much like a rubber band. When you twist it all the way around, if you keep twisting, it doubles and triples on itself. Right? Remember those planes when we were little kids? We used to wind them, and the rubber band doubled and tripled and all that. Well, that happens in your spine. And if you measure out the mathematics, I actually got my license suspended because I was taking full spine X-rays from here down in the sitting and standing position and measuring out every vertebra and disc and making a three-dimensional model out of this. All right. Nowadays, that's no big deal because you have the computers and you could do computer-aided design and all that. But in the 80s, nobody had these computers. I was doing this by hand. And the amount of mathematics and the time it took was pretty astonishing. But what happens is, if the mathematics of how these things unwind is very much the same if you took a very high-speed camera and you twisted up a rubber band and let it go, and you watched the way it unwound, the mathematics is very, very similar. All right. And the rubber band is not symmetric. All the rubber is not aligned straight and everything else like this. And it gets kinked and all of these other things. And it's very much like that. And it's pretty astonishing. And that happens. I was actually last night, a scoliosis group had me talking. All right. And people talk about scoliosis. All right. And medically, a scoliosis is a sideways curve of your spine. But that's ridiculous because there is no such thing as a sideways curve of your spine. It's a three-dimensional twist. All right. These chiropractors talk about mirror image adjusting. Okay. If they take a picture in an X-ray and your spine curves to the right, they push it to the left. Well, it's ridiculous. It doesn't work out mechanically because it doesn't curve to the side. It twists to the side. And if you try and push it the other way, it may twist it more. Right? A lot of times the scoliosis happens because of a different mechanism than anybody believes. All right? If you look at your lumbar spine down in the lower back, all right, the spinuses where the spine comes off, they're not thin little things like this. They're big, thick things like your thumb. All right? So what happens is at the very lowest vertebrae, L5, lumbar 5, the fifth lower, if that thing slides forward on the sacrum, okay, it starts to tip forward. Now, there's supposed to be an angle between the sacrum and the lumbar vertebra that's supposed to be about 15, 20 degrees, somewhere in there, all right? If you look at people with a scoliosis, almost all of them have less than a 5-degree, all right, or less than 10, which means their body's pitched forward somewhere between 5 and 15 degrees, all right? Well, nobody wants to be pitched forward like that, all right? But that vertebra is forward in a direction your body can't self-correct, so you have to lean backwards somewhere else. Now, if you go to lean backward, those spinuses jam because they're this big and this close. And so they jam together and it hurts. So you don't want to fall and you don't want to hurt, so you start twisting this thing. And in most people with the scoliosis, if you take a side view picture, you'll see that lumbosacral disc angle is in the single digits. All right. And the whole curve is because they're trying to avoid falling forward onto their face. Now, this explains why bracing doesn't work. All right. People get in these braces, and what's the first thing they complain about? I've been in the brace for 6 months, and now the curve is bigger. Well, the curve is bigger because those curves up on top are either compensations or compensations for compensations. All right. And so they're trying to get rid of the compensations, and the body fights against that and creates a bigger curve. Right. What you really need to do is you need to find the bones that are out of place that the body can't self-correct, correct those, and make sure you leave everything else alone. All right. If you do that, eventually the person will unwind. They get out of pain pretty quickly, but they unwind through the scoliosis. Now, if there's bony changes where the bones are compressed there, there's going to be a limit to how much their body can unwind, right? But the interesting thing about unwinding, remember I talked about as you get better, whoops, sorry, as you get better, this thing unwinds, all right? Well, when it unwinds, if you think about it, it goes toward the injury position, right? People think it's going to unwind and then it's going to go back into position, but you can't go back into position because you don't have any muscles that pull in the direction needed. So as it unwinds, it goes toward the injury position. And people are always telling ABC practitioners, I feel like when I had this injury 10 years ago, 15 years ago, 20 years ago, 5 years ago, whatever it is, they remember that when that injury unwinds. All right. Then I always train my practitioners to say, ask them, yeah, but do you notice you don't have the disability you had then? And people go, oh, yeah, it feels like that, but yeah. All right. And the reason they don't have the disability is because they're so much more stable and everything else is better aligned. Now, when one of these things loosens up enough, then you come in and we're just doing the usual protocol where we check to find what's out of place that the body can't self-correct, and we correct it the best we can. And this thing goes back into place. And what goes back into place, you don't get better. You get well. Right? You understand the difference? Better is it's there, but I'm better. This thing goes back into place and you get well. So people who do ABC for 8 to 10 months, a year or two, and it does take that long for your body to unwind, not because of us, because your body just can't go any faster. All right. What these people are healthier than they've been since they've been born. And people say, well, I don't know, and these people are not familiar with babies that come out and they're all twisted up and everything. Babies don't come out okay all the time. All right. They're in the womb cockeyed and everything else. We treat plenty of babies. And I mean, we have kids that have failure to thrive. All right. You know what that is? That they don't expect them to live 6 months because of how bad their body. They get treated this way and they do okay. All right. Some of them do great. And some of them do. I mean, I had the first failure to thrive baby I had, I will probably always remember. All right. The woman came in, she was crying because she had 3 other kids or 4 other kids. And this kid never cried and never, didn't suckle or anything like that, was having trouble. And the kid was like 4 days old or whatever. And they said, well, we don't think the baby's going to last out the month. And the woman, it's a story how she ended up at my office. And I treated the baby, and the baby had this big belly. All right. And I treated the baby, and all of a sudden there was this horrible smell. And I noticed this stuff running off the table. And I was like, and the baby started screaming, crying. And when the baby started screaming, crying, the woman started screaming, crying. And I was like, but this is a good thing. And she goes, no, you don't understand. This baby never cried. All my other kids cried, and now the baby's more normal. Oh my God. And she's saying all that. And I'm standing there going, what? And I realized that the reason the kid's belly was all extended, couldn't poop. And so you could see the belly go, and it all ended up on my floor. It took a week for me to clean that stuff up enough so I could use the room again. Right. But that kid, I moved out of Connecticut. That kid was about 5 years old. And the mother always knew when to bring the kid in. Okay. Because what happened is if they were walking, like in the mall or something like that, all right, if the kid was on her left side, the kid would constantly walk in and bump into her. Or if the kid was on her right side, the kid would always keep going. And she'd have to hold him in, and she'd come in, and I would treat him, and he would walk straight for a little while. That kid is now, let's see, that kid's got to be like 30 years old now, and I'd love to tell you some story, but I lost track after I left Connecticut. He was about 5, right? And there's all these stories. I actually got a text the other day Thank you so much. I've been to, a zillion chiropractors, a zillion this, a zillion that, and everything else. And one of my practitioners did this. We actually have a lot of Amish practitioners, all right? And I don't know if you realize the Amish people only have an eighth grade education. They stop at eighth grade and then they do whatever they do, right? Well, I can teach anybody how to do this. The chiropractors talk about this big education and everything else, and they give them a big education like a medical doctor. But as far as doing manipulation, I can teach anybody from anatomy all the way up to being good at doing this. I can teach everybody the whole thing in about a week. And I have the online course. If you go on
Wow.
AC Miracles, yeah, it's got the online course. And if you're willing to push people around, if you're not willing to push on people, don't do the course. Okay? I mean, that's what this is. This is pushing on people. All right? But if you're willing to push on other people, you can learn this. And frankly, we have a lot of people who do the course and they only treat their family. All right? Especially the Amish. Okay, they've got 5 kids, 6 kids, 8 kids, whatever their story is, and to take them to somebody and pay $30 or $40, they charge a bunch less than most people, but to pay $30 or $40 for 5 people, all right, once a week or something like that, it's a lot of money.
Yeah.
So they take the course, and the course is about if you include a live training, you have the online course and then there's live trainings. If you include everything, it costs about $4,000. All right. But if you go to a chiropractor or a physical therapist or even a massage therapist, once a week, they're going to charge you more than $100 a week. And over a year, that's $5,000, 52 weeks. All right. So if you do this, if you learn this and you treat your own family, and somebody else in your family also does the course, so they can treat you because you can't treat yourself, you get your money back pretty quick.
Mhm.
All right. We actually have a lot of couples who do the course together. All right. And then they come to a live training and they treat each other. And every once in a while, they go to somebody who's a real, you're not going to be expert in 2 weeks, but you're going to be good enough that you could fix things beyond what you imagine, even in 2 weeks. I can't tell you how many beginners, when we do the live trainings, we insist that the beginners take the basic seminar twice. And so when I teach the basic seminar, I say, how many people are here for more than the first time? And they raise their hand. And I say, how long have you been there? And just this last time, I took it 3 months ago. All right. Have you been using it in the last 3 months? Yeah. How many people have told you that you fix things that they never imagined could be fixed? And they all have stories about, oh, they went to 9,000 people, they went to 10 chiropractors, they went to this, they went everywhere, and I treated them, and within 3 visits, oh my God, you wouldn't believe. All right. And so anybody can learn this. There's no magic, and it doesn't take years to learn it. Okay. You can learn it in a week. Now, you want to be expert? That's going to take a little bit of time because you got to handle a lot of bodies, right? But anybody can learn to do this well enough to help more people than you can imagine in a week, maybe a week and a half. All right. I don't know. Do you have any questions on anything, or I tried to cover everything, but
You did a
I don't.
great job. You did a great
Yeah.
job. Riley, this is for you because I could see you putting hands on people and I don't want to. Riley, this is totally you. Like you
Uh,
could be busting some people up and fixing them up in a good way.
oh my
Um,
word.
yeah, look at how she's smiling, doctor. I mean, like, but this is actually something that's right up our alley because we're
It,
we're into the wellness sort of space, and I think I told you when I was talking to you briefly that the goal is to avoid technology, right? The goal is to maintain health and wellness and not get to that point where you need that. And I would like to circle back on some questions that I have, but Riley. I'll let you go first if there's any feedback or anything you want to say first. You
oh,
were taking a
no,
lot of notes.
I always take a lot of notes. You know that. You go ahead while I scroll through my notes.
Okay, so I want to circle back on a couple things that you talked about. Now, with the with the COPD and with that sort of caved in chest area, was that initial thing that we did with the first rib? Was that one of the core things that opens up to kind of help alleviate the pressure that's being put on the lungs and the heart?
Well, when you talk about the core thing, all right, the answer is it depends. All right. I kept statistics on this for a while, and it works out to be about 50%. For 50% of the people doing the first rib maneuver, because they have their main mechanical problem somewhere in the upper body here,
Hmm.
it creates a phenomenal, unbelievably big change. Okay. And it's a core thing. But for about the other 50% of the people, and I measured this over a couple months, so this isn't a years long study, it's just a month or two. Um, but for the other 50% of the people, they have mechanical problems elsewhere in their body that are more important than the mechanical problems that they have up in this area of the body. And so for those people, the first rib maneuver is very important because they do breathe better and improve, but it doesn't handle their major mechanical thing. All right. Anybody who says this one thing is going to handle everything, everybody who has blah, 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 they're going to find out that's not true. All right. One thing I did, remember I told you I got my license suspended because I took sitting and standing full spine x rays? I did sitting and standing full spine x rays every 2 weeks to 6 weeks, depending upon the person, for about 17 years. Okay. Everybody who does ABC is very mad at me because when I went out of my practice, which was uh, about the time I started teaching, I sold I had a really big practice and I ended my practice and I sold all these X-rays and they're like, "Oh my God, do you understand how much research you lost with that?" And the answer is, "Oh, I never thought about that. I know the information, so I didn't keep it for other people." And the truth is, it's a big problem because somebody's going to have to redo all that, right? But nowadays they have MRI and things and moving MRI, so you could do even a better job at that. All right. But I did sitting and standing full spine X-rays for 17 years on people, and I did it consecutively. Some of these are actually on my website, and I have some of them that I digitized. In those days, we had to use a movie camera and capture a frame, and it's not like now where everything's digital, right? But I do have some, and some of them are actually on my website. Um, there's actually a video on my website. If you go down a little bit, it's how and why the ABC technology works better than anything else. And by the way, that word technology, a lot of people don't realize that the meaning of the word technology is use of knowledge, right? Science is knowledge, okay, and technology is just use of knowledge. There's baking technology, which is which yeast to use and all this stuff. There's religious technology, what God to pray to or whatever. That it's just use of knowledge. You're talking about the electronic technology and everything they're using for bodies, all right? Well, ABC is body structure technology, and anybody can apply it, all right? But anyway, so that is not you can't really say it's a core problem for COPD, but you can say it's a core problem for just about everybody because I have not yet met a human being who has not had the first rib maneuver done that didn't need it. All right. And that's not because I think I'm the biggest, and the best and all this other stuff. People just collapse forward. All right. Now I don't know what your religion is or anything like that, but whoever designed bodies very specifically designed them to collapse in a certain way.
Yes, he did.
All right. And who
Mhm.
it is, where it is, I don't know and I don't need to know. I just know the bodies are here and bodies collapse in a very, you know how they say everybody's different? Okay.
Hmm.
All right. Well, first of all, you're not your body. you're the thing that runs it, the spirit, the soul, whatever you want to call yourself. All right. The vital essence, Elan Vital, or, whatever. Okay. That's you. But your body is just, you know how people say my soul,
Mhm.
right? That's sort of silly. And the reason it's silly is because they are the soul. All right. My body, yeah, you have a body. My car, you have a car. My pen, you have a pen. All right. But my soul, no, no. That's like saying my me. All right. You are that. All right. All right. So if you look at human bodies, every body is pretty much the same. Women are different than men. They have a wider pelvis mechanically, but it's not significantly different on a mechanical skeletal basis. All right. So all men pretty much the same body, different sizes, and they develop a little legs longer, this or that. They develop a little bit different, but basically the same, and women basically the same. All right. What makes people different is what goes wrong, which bones go out of place, in which order, how far, and all that is a little bit different for everybody, but you're on a certain framework, so it's similar. Okay. So the short answer to your question is yes, it's a core thing for a lot of people with COPD, but not 100%.
So people could technically go to the ABC Miracles website, find a local practitioner, at least start getting they could go through some of the process and first rib and then doing other additional alignment and different things that, because like you said, it could be multiple different things that need to be done, but that would be a place where you could go. And it makes perfect sense. And like you said, when you're talking 2 ounces of extra blood pumping through extra every heartbeat, and the amount of blood that can circulate and just all that extra flow coming through by just relieving pressure on the chest area. That to me really makes a lot of sense. I mean, it's common sense, honestly, but that really, from a structural standpoint, taking that pressure off there and opening up that cavity and giving those organs more space, that seems to be something of vital importance that everybody should really have done.
Oh yeah, it's huge.
And then the fact that those muscles, like you were saying, they don't have the ability because of the way that it's situated to be able to compensate back. It needs to be somewhat manipulated because you don't have that muscle to be able to adjust or pull it back in that opposite direction.
Yeah, well, a lot of people hate me because they like their soft tissue and muscle and all this other stuff. But the way it works out mechanically, if your skeleton is not aligned, your muscles are not going to be aligned, and your fascia is not going to be aligned, and nothing. It's the easiest way. One acupuncturist told me they used to do 90% needles, all right, and they learned ABC, and now they're doing 90% manipulation, and they do their diagnostic. All right, I don't know if you know the pulses and all. It's a whole. When Nixon opened up China in the 70s, I was in chiropractic school, and this guy Jerry Carey, who was a chiropractor just north of St. Paul, Minnesota, hired some acupuncture master to come over, and he worked in his clinic and he taught the seminars, and he made it very inexpensive for the students, which was very nice of him to learn this. And so I was practicing classical acupuncture in the late 70s, and when I got out of school, I was one of the first person in Connecticut doing needle acupuncture. All right.
Mhm.
And then I figured this stuff out, and it works so much better for just about everything that I just gave that up. And a lot of these acupuncturists that learn ABC tell me they go from 90% needles to mostly manipulation. And one of the guys said, I guess it's because if you get your body lined up properly, the meridians, the energy channels line up, and you need less in terms of, you don't need none, but you need less in terms of the needles.
Mhm.
And I was like, okay, that makes sense. I have no idea if it's true or not. Okay. Don't say I'm going out and saying you don't need acupuncture if you get your body structure straightened. I didn't say that. This other guy said it. I can understand it. I don't know if it's true. I didn't research it. I don't know. All right? I'm a weird guy. When people say, "What do you think about something?" If I don't know, I say I don't know.
Yeah.
And they say, you must have an opinion about it. And I say, yes, I do. And they
Hmm.
say, what's your opinion? I say, my opinion is I don't know enough to know anything about it. And they get upset. They get upset with me because they think I should.
They want to try to pin you down into something. Well, you were talking about the alignment of the back, and as soon as you started getting into the alignment of the back and how you can manipulate the back, but if other places are not in alignment, it's really not going to help. It's not going to hold like you were talking about. The first thing I'm thinking about, and get your feedback, you get that out of alignment, and all of a sudden I'm thinking knee pain, hip pain, and other pain because the body's trying to compensate, and through that compensation and adjustment, and like you were talking about the twisting, it's throwing off the pelvis, it's throwing off other places, which then goes straight down into the knees. Just from your experience, how often do you see improvement in knees and hips after you've had an ABC adjustment for, like, say, starting with up here and just like a full alignment? How often do you see pain in other parts of the body dissipate?
Great question.
Almost always.
Hmm.
Right now you have to understand your feet. Okay. So you have, below your ankle, you have, I mean, below your calf, at the bottom of the calf, you have those two bones, and then you have your ankle. And the ankle goes halfway down the foot and out to the heel. That's where your ankle really is. All right. And there's a bunch of little bones. People think your wrist is this thing right here, but that's not your wrist. That's the end of your forearm. Your wrist actually goes from the end of your forearm here out to here, and there's two rows of small bones that make up your wrist. Okay? So similar in your ankle. There's rows of those bones there. And when those bones, your foot's like this, if one of those bones drops downward, you have no muscles that can pull them up. All right. So we in ABC we call that a primary biomechanical pathology. And the reason we call it primary is because it's the most important. It's not first, it's first in importance. Okay? So if somebody's feet collapse, if you have one of these bones collapsed, that turns in and that turns your calf and the two bones in your calf and that turns your femur and that turns your spine. So it's your entire body. But if all these things get handled, it disappears like crazy. All right. I just had yesterday, this guy was in, he's been playing basketball and using an ankle brace for about 20 years when he sprained his ankle. All right. I've been treating him a little bit less than a month. And he said, I'm playing and I don't need an ankle brace anymore. And I was like, yeah, I know. And he's like, this is why people don't like you, Jess. All right. Why can't you get excited about it? And I'm like, it happens all the time. What other people think is the big story is for ABC practitioners is the small story
Hmm.
because it works consistently and predictably. And what happened is, excuse me, what happened is this guy twisted his ankle 20 years ago and he knocked some of the bones in his foot out of place in a direction the body can't self-correct because there's no muscle pulling it. So if the body can't self-correct it and you don't get somebody else to fix it, it's staying there.
Wow, you make this really easy to understand.
It's so simple to understand, and it's actually it's both very simple to understand, very simple to learn how to fix, and complicated as hell to really know what's going on in the body because there's so many little pieces.
Yeah.
Yeah. The biggest problem people getting ABC have or people doing ABC have is where they want the body to go is usually not where it needs to go.
Mm.
All right. Like if somebody's all twisted up like this, in order to straighten this out, they have to get more crooked this way
Yeah.
to line up the top with the thing that's going sideways. And then after the top lines up with the thing that's going sideways, then it can untwist and unlock the
That
next.
makes sense.
All right. And so, I have people who come into me and they leave. I don't know if the thing they leave and they're standing there like this and they go, "Are you going to leave me like this?" And it's like, "Are you hurting?" No. Do you have any restricted motion? No. I said, "Yeah, that's just your next unwinding position."
Wow.
That's, and it's actually funny. I travel so much and teach so much and everything, and people don't realize, if I go from here to Australia or here to China to teach, it's 12 hours difference. And
Mhm.
my experience is, I don't care what they tell you, the average time it takes to acclimate to a different time zone, it's about 1 day for every hour you go. So, people say, well, when you're traveling, you should work out so you don't gain so much weight. Well, let me tell you, you travel from here to Australia, and for that first 2 weeks while you're trying to acclimate into their time zone, you're not exercising too much. You're too whacked out.
Yeah.
All right. So I end up gaining a lot of, but you know what? I discovered something gaining all this weight because I was always in shape when I was younger and everything else like that. As long as your body is in mechanical shape, you can get away with murder. Okay. All those people who
That's
smoke
good
and
to
their
know.
lungs, yeah, you know all those people who smoke and their lungs are all clogged up. Okay. This started happening in about 1985, 4. All right, I was in practice in Milford, Connecticut, and it was in that time it was a very blue collar area. All right, they had a lot of factories there and things like that. And all these guys in those days, they used to get chest X-rays to measure out their lung congestion and all this other stuff. They had a 6 month physical every year for their or every 6 months they had a physical for their company. All right, and I started getting people who came in, and I would tell them, I'm treating you, and your breathing is going to be better, and it's going to help clear out your lungs and all this stuff. And after I was in practice about a year or two, 2 or 3 years after I started discovering this stuff, right? These guys would come in and say, "Hey, you remember you talked to me about the breathing stuff?" I say, "Yeah." He said, "Explain that again." I said, "Why?" They said, "Well, I just got back from my 6 month checkup, and the doc said, I'm glad you stopped smoking." And the guy said, and I said, "Oh, okay, you did?" And they said, "No, I'm still smoking 2, 3 packs a day." And I said, "So, well, why did the guy say that?" He said, "Well, he took a chest X-ray, and my lungs are a lot clearer." I said, "Yeah." I said, "What congests your lungs is not the crap you put in there. It's when your body's twisted and your chest doesn't work, and you can't clear your lungs out." I said, "Remember all those commercials with, they have the cilia, the hairs are pointing up, all right, and it breathes up, and then you put cigarette smoke on them, and it doesn't work. They still work, okay? And now that you're breathing so much better, it's pushing up all that crap, and your lungs are more clear." And they're like, "Okay." And their wives were all pissed at me. You know why their wives were pissed?
Because they're still smoking.
But still smoking, yep.
No, because they're afraid they're going to get lung cancer because they're still smoking.
Hmm.
They said, "All right, their lungs are cleared out. They don't have to worry about emphysema and all that, but we're worried about cancer." All
Hmm.
right. And I'm not going there, but you know,
Yeah. Well, let
there's
me ask you. So the basic breakdown with the body is that you've got some areas where the muscle, like you said, can compensate and help get it back into alignment. But then there's a lot of places like the back where there's not that extra muscle to help compensate it. So since it can't do that, it starts twisting, bending, and doing all different types of things to relieve the pressure. And so when you're going through an ABC alignment and you're going through the ABCs, obviously you know every single part of the body. You just talked about the wrist. That seems to me like something that a lot of people wouldn't put a lot of time and attention to. However, with all the time on computers, with all the carpal tunnel, with all the other things going on, with the change that we're doing and just using our wrist, something as simple as finding a bone out of place in the wrist or putting that back in could have a huge impact.
yeah, but it doesn't work that way. You know
Hmm.
why?
Why?
You go to the gym,
I do.
all right? You know how you do pull downs? Well, when you do pull downs, you're using a muscle called the latissimus dorsi, or the lat. All
Hmm.
right. And what that does in your back, that attaches from about the middle of your back down in your spine. All right. Sometimes it attaches to the pelvis in people, sometimes it doesn't. All right. And that bone comes up. I actually show this on my video. That bone comes up. It's a big flat bone. It comes up across your back and it gets thinner. All right. And it gets to be a tendon that's about as thick as your finger. And it attaches on the front of your arm right here. All right. So it goes from your arm down under the skin this way, and then it attaches to your back. And so you wouldn't believe how many people have tennis elbow or something like that. And if you take their lower ribs and just grab their lower ribs and lift them up about a half inch and then ask them to test out their tennis elbow, you'd be astonished at how many people immediately don't have tennis elbow with you holding up their ribs, because it lines up the spine back here and it changes the pull on the lat, and that changes the pull on the arm. And all of a sudden, a lot of arm stuff goes away because it's from your lower back.
Wow, wow.
Wow.
Everything is coming
That's
from
on.
something else.
Yeah, if you go if you're interested in that, Riley, if you go to that video on why ABC works,
Yeah.
the first 15 minutes talks about the bones out of place that the body can't self-correct, right? But if you stick with it after that first 15 minutes, the next 5 minutes talks about exactly what I just talked about how the lat attaches. And I show a skeleton with the way the lat attaches and the way it twists and everything else, right? And that happens down in your pelvis with your feet and legs, right? So if you have something out of place in your foot, it goes up and creates a problem. If you have something out of place up here, it goes down and creates a problem, and it goes up and creates. So everything's connected. All right. We do endonasal corrections. All right.
Wow.
Where you have to correct the bones in the person's head. Okay. So the only really effective way to do that, a lot of people, they put their finger in and they pull and everything. I've tried all this stuff to exhaustion. And the only thing that I found effective is when they put a balloon up your nose in a certain place and they blow the balloon up and it moves the bones in your skull. Right? Now, when I had somebody teach me how to do that, the only thing they knew how to do, there's 6 places. All right, there's 6 nasal concha, 3 on each side. All right, one down low, just above your palate, one in the middle up here, it's about 45 degrees this way, and one right up in here goes up into your superior sinuses up there. Okay, they did 6 of them. They did all 6. And so they taught all this stuff, and the guy spent a whole day, talking about these bad reactions that people have and how to handle it. Okay? Before we even got close to doing any of this stuff. The guy talked about the whole day with this stuff. And so they did my first one on the right, and it felt weird having a balloon up your nose, and that was weird. And then they did the middle one, and that didn't feel too good. All right. But, and then they did the superior one on the right side, and my head felt like it exploded. Oh my God. Oh, wow. And then blood started dripping out of my nose. And I'm not talking a tiny bit of blood. I'm talking about a steady drip like a faucet drips, okay, causing a problem. And I got up and the guy said, no, keep going. I said, I'm just trying to get a paper towel so it doesn't get on my shirt. He said, okay, got a paper towel, put it over there. They did the superior one on the other side, and not much. Didn't hurt, didn't help, didn't do anything. Still bleeding like crazy. All right. Then they did the middle one on the left side, and all of a sudden everything went, and it was like, oh my God. And I blew out, I blew blood. It was red. Got another paper. I was using paper towels because there was so much. I blew it again, and it was less red. And I must have blown my nose about 8 times, and it got less and less red, and it got pink, and then all of a sudden there was nothing. So I found out, all right, this stuff works, but again, this guy doesn't seem to know what he's doing. All right, and then they did, after that stopped, and I stopped blowing my nose. They did the lower one on this side, and I knew something was off. and I didn't know what was off, and I was trying to do this again. And before I had somebody do this middle one again, I was trying to push on my head, and I whacked my head as hard as I could right here. This is called the glabella, right on here. I whacked it as hard as I could, and everything came back in focus. All right. And so for a while I thought, oh, you don't have to put the balloon up there. You can just whack people in the head. And the answer is that works maybe 25, 30% of the time. The rest of the time, it just creates a whiplash effect and creates a problem. All right. So it's not a good thing to do unless you get lucky. All right. But but this guy was neurocranial restructuring. It was what's his name out in Washington, some naturopath. I forgot his name. But anyway, for years on his website, it said he was teaching this, and Dr. Jutkowitz figured out how to do the diagnostics. And so what I figured out was if you check on where the sphenoid bone, which is in the middle of your skull here, if you check on the sphenoid and you do the checks that come with ABC, you could figure out which one of these you need to do. All right. And if you need to have that done, nothing else works. All right. We've got tons of people, they do an endonasal and their entire body changes. All right. And we've got tons of people, they do an endonasal and it just changes their head. What it changes is going to vary all over the place. Like I said, it depends on where your major mechanical problems are. But if you have that and nobody does it, even with the ABC on the rest of your body, it's not going to fix it. So what you said, you have to figure out where it is on that person's body is exactly right. And it's not difficult to do. All right. Like I said, I could teach you the whole thing in a week.
Doctor, I do want to just put out there, anybody watching this video, you can get this training. We're going to have links down in the description. You can get ABC training. I already see Riley over there, man. You're gonna bust me up, girl. You're gonna be getting the training. And I'm just saying that facetiously but she loves to work with her hands. She is kind of a healing type of a personality. And to have that knowledge to be able to do these adjustments and kind of hone in on that, I think is really a blessing.
Well, hang on.
Yeah,
Sorry to interrupt.
of course.
They're not adjustments. All right.
Okay.
Adjustments. Chiropractors have appropriated that word. And they see what happened is the chiropractors, and this, I know this because I was there. Okay. In the late 70s, in the mid to late 70s, the chiropractors, we had x-ray and everything, and they had a bunch of more science-minded guys going into chiropractic. And they said, we're going to prove chiropractic. And so they had a curve in the spine and they adjusted the person. And, they took an x-ray, saw a curve in the spine. They adjusted the person. All right. And they have a whole description of what an adjustment is. And it's got nothing to do with just fixing a bone out of place. They did that. And then they took an x-ray. And even though the people reported that they felt better, the spine was more curved.
Mm-hmm.
And the reason that happened is they did not understand unwinding.
Mm-hmm.
They have no idea what's going on a mechanical basis with unwinding, right? You probably understand it more from this description
100%.
All right.
Yeah,
So
that
don't
whole
call it adjustment, call it a correction.
a correction. Okay, thank you for that. That whole explanation on scoliosis was mind-blowing because for the first time ever, scoliosis now makes sense. It makes sense on what's causing it. It makes sense on why the curves are there. And it also, like everything about what you described, and especially why braces don't work, because that is just like, that's kind of like out of the Frankenstein era when I think about that, because it's just really trying to patch and put something on there, but really with not really any scientific understanding of what's behind it. Have you ever heard of a Dr. Tucker who was out of California?
No.
Okay.
By the way, a lot of people say, why don't you publish this research? And the answer is they won't publish it. I started trying to publish this research in the late 80s and 90s, and the chiropractors wouldn't publish it, and nobody else wanted to publish a chiropractic paper. And now they say there's a million places where you could publish. but they don't want to. We actually just had two in the Australian publications. We had, you ever hear of stiff body syndrome?
I have not.
One of the singers has it. I think Gloria Stefan or somebody, and one of the singers have it. But
Yeah, it's the girl that did the what's her name?
I don't know. I
She
don't
did
know.
the Olympics.
Yeah, whatever. Whatever. But she had it, and they just published in the Australian, from wheelchair to walking in 6 months with advanced biostructural correction, and it's a case study that's published in the chiropractic journal down there, and there's another one about pulmonary function. So it's starting to get in there, but I mean, these guys, I tried to give the entire research thing to the chiropractors. I was one right now. I tried to give it to them in the mid 80s, in 1986 or 1985. And I said, I can show you why chiropractors cause stroke and heart attacks when they do. And I got a letter from John Wolfe, who was the originator of Northwestern College of Chiropractic, which was where I went to school. And it said, I can't think of a more damaging assertion than that chiropractors can cause stroke. It's like, what's the big deal? It happens. It's all over. Everybody knows it. It happens. It doesn't happen much, and it's rare, but I can show you how to do it. Not only that, I can show you how to fix it when you do it. All right. And there's a whole, pardon me for jumping in and interrupting you, but
Thank you.
there's a video called The Ultimate Guide to the Fuzzy Patient, which was done by three of my Australian practitioners, which explains the whole thing. It's my information, but they present it better than I ever presented it. All right. And it's part of the course. Okay. And there's a difference between a pseudo stroke and a stroke. All right. They look similar, but they're very different. Okay. And what the chiropractors do and what other people do in manipulation do, and a lot of times just what life does, is not really a stroke. It's what's called a pseudo stroke, and it's easier than pie to fix. Right. Anyway, sorry.
No, that's good. But I mean, even to follow up on that, so when the body goes out of alignment, can it obviously is restricting blood flow because we were just talking about that with the heart. And so is that kind of what's happening? Is that the body alignment's off and it's restricting blood flow or, kind
It
of affecting the.
if you look at Bregg's work, okay, he's the guy who wrote Adverse Mechanical Tension on the Central Nervous System.
Hmm.
It's a combination of restricting blood flow and just plain pulling on the brainstem. Right? You know how people talk about a pinched nerve?
Hmm.
It's not true. It's close, but it's not true. If you look at Bregg's research, it's stretching. If you stretch a nerve to a certain point, the nerve will still be alive, but it will not work. Okay, it won't propagate a nerve impulse. And if you look at what's his name, Shoki Yamada is also a neurosurgeon. He did research. You could look on PubMed. The paper is adult tethered cord syndrome, and he has the same information. If you stretch a nerve, it doesn't work. And he did, leading up to that adult tethered cord syndrome article, he did a whole bunch of research and proved cellularly and chemically that if you stretch the membrane on a nerve, if you stretch the outside membrane of a nerve, it won't propagate a nerve impulse. And if you take the stretch off, it immediately will. All right. And that's why, like, people who have cerebral palsy, um, there's um, there's two types of paralysis. One is flaccid paralysis, where everything's just loose and everything like that, and the other is spastic paralysis. All these guys are walking around spastic. All right.
Hmm.
So the simple explanation is you have two nerves that control a muscle. One is from the brain down the spinal cord, and the other is from the spinal cord to the muscle. All right. Now, the one from the spinal cord to the muscle is always trying to fire. It's always trying to make that muscle contract. And the one from the brain down the spinal cord inhibits that from happening. All right. And it's chemistry. You know, how you set it off and everything is in a whole other story. But it's chemistry. So if you damage the nerve that goes from the spinal cord to the muscle, you're going to have this flaccid paralysis and it's not going to work. Okay. If you damage or get to not function the nerve, it's called the upper motor neuron, the nerve from the brain down the spinal cord, it's not going to work and people are going to be spastic. All right. So one of the ways that happens is your body goes forward and it pulls on the brain and spinal cord. And so those nerves, some of those nerves don't work. All right. So if you take somebody with cerebral palsy and you treat them with ABC and you have to work hard, it's really hard to break up they have meningeal adhesions inside the spinal column. Okay. Medically, they call them perineural adhesions. We call them meningeal adhesions. The meninges are the coverings of the spinal cord and brain. If you work really hard and on somebody with cerebral palsy, usually about 30% of their spasticity disappears in the first week. Now, fixing it 100%, you're not going to do. There's too much going on. All right. But like people with multiple sclerosis, if you check, he's a chiropractor, Springback Chiropractic. His name is Patrick Bain, Bain. He had multiple sclerosis when he started ABC, and he asked me about it. And I said, look, I said, multiple sclerosis is just these hard things in your spine that affect you. And they happen probably because of some mechanical thing. And according to Bregg's research, as long as you take the stretch off the spinal cord, the symptoms completely disappear. I said, but to have your body unwind, if you have that happening, you have to be so bad mechanically, it's going to take a long time. And it took him about 5 or 6 years, but he's got nothing. Definite diagnosis of multiple sclerosis. Definitely they have the MRIs with the sclerotic lesions and all that. Gone. But it's 5 years, and it's an up and down journey. It's not a smooth journey where you get better. It's you get better, your body unwinds to a certain position, you get worse, you think it's coming back, but if you stick with it, you unwind to the next position and you're better than you were. And you go on his website, I think he talks about it. And he says he's had many people with MS contact him, but nobody wants to take the time and go through all the crap you have to go through to get rid of the MS. So they die. It's like, hello, this is a life or death thing. You know, you take 5 years out of your life, and yes, it costs a bunch of money, but it's probably cheaper than what you're doing now. Okay. And you got a chance. And he says almost nobody does it. So, you know, I figured out.
We see it all the time. We see it all the time.
I figured out ABC on my own. I don't owe anybody anything.
Yeah.
You know, people say you should give this away for free so everybody knows it and everything. You know what I had? I got my license suspended by the chiropractors because I could say all this stuff. They came after me for all sorts of other crap. I don't owe anybody anything.
Yeah. The problem is
to
yeah, and not to interrupt, but the problem is too, when it's given away for free, people give it very little value. They don't follow up on it. When you're locked in, and this is a career path, and this is a career path, and you say, I'm in and I'm going to invest like it's a business, you take it much more seriously, you know, and you're now vested into getting through that and learning it and really putting it to use. And it has value. So like you said, it's coming from a lot of experience. I really do love the fact that you're at Purdue and you're getting engineering information. And then were you up in the cities? You're up in the Twin Cities?
Yeah, I went to Northwestern College of Chiropractic, which was at that time in St. Paul.
Okay.
Right now it's out in Bloomington. These chiropractic schools, they weren't happy where they were. They wanted to be like the medical people. And so they've created this big edifice and everything else. And they spent too much money and all this other stuff. And so now they have a big campus with a college. And now it's Northwestern College of Health Sciences or something. And they teach acupuncture and they teach massage. They teach all this other stuff. And the answer is, why do they teach all this other stuff? And the answer is because they know chiropractic doesn't work in the way it's supposed to. All right. Anybody who says anything about when I graduated, there were 60,000 practicing chiropractors in the United States. All right. That was in 1980. All right. It is now 2024. And if you look on the website for the American Chiropractic, so the most optimistic estimate for how many chiropractors there are in the United States is 70,000. So the profession expanded a little bit less than 15%, and the population has just about doubled.
Mm-hmm.
So the chiropractic profession is shrinking no matter what anybody says. All right. And the reason the actual numbers are half the chiropractors that graduate from chiropractic school are not practicing within 5 years because they find out it doesn't work and they can't make a practice that supports them. All right.
Yeah. I want to circle back to Dr. Tucker, then I'm going to throw it down to
Oh, okay.
Riley,
Sorry. Yeah.
which is fine. No, because I'm just curious if you knew him. So back, man, I don't know how long it was. It was probably 30 to 35 years ago, 35 right around there. I basically had a disc out of my back and had the sciatic pain, and it was just, I mean, I consider myself to have a pretty high pain threshold, but that broke me. I mean, after about 3 or 4 months of that, and I couldn't sit up upright at all. Every time I was being driven somewhere, I was laying in the back seat of somebody's car, and I had gotten turned on to this Dr. Tucker, and Dr. Tucker was based out of Southern California. And he basically, his whole premise on healing the back was the first thing he did is he looked at your neck, not your lower back where the mess up was. He went right into the neck and did x-rays. And almost every time he'd say, yeah, there's something out right here. I can almost point to what vertebrae was out in my neck. And I went in the first time I went there and got that adjusted. And for the first time in probably almost 2 months, I could actually sit up straight. And within, say, 90 days, I was almost back to normal. And I was literally begging for the surgery. Like I was like anything that'll take me out of this pain. I didn't want to do surgery, but I was like, but Dr. Tucker really saved me. I mean, he really did. And back in the day when he was operating, he had to be very careful. I mean, they did not like him out there in the medical community. They made his life difficult. Like they didn't like that he was offering a fix without a surgery. And so Dr. Tucker kept a very quiet, like you really only found about Dr. Tucker was through referrals of friends or people that knew Dr. Tucker. And I'll always be grateful for him because it takes a lot of courage, even with what you're doing, to go against the stream and go against the flow and go against the traditional, structure, even though it's completely broken. And like you said, it hasn't gotten any upgrades and it's not integrating updated knowledge and information like what you've obviously done. It takes a lot of courage to do what you do, and I don't think most people understand that. I know you probably do because you're always going to take blowback, but to
Oh,
push through that and to say, you know what, I know what's right and I know what works, and I really don't care about blowback from people that are not in, that don't understand it. It's not coming from a space of knowledge. It's coming from a space that you're upsetting the cart and upsetting the norm, which needs to be upset, quite frankly, as you well know. So I really want to just thank you personally and say, thank you for the work that you do. Thank you for the courage. Thank you for the knowledge. Thank you for offering these courses. And also for anybody out there like Riley, Riley, you need to get on abcmiracles.com so you can
I
find a
already did. He's in,
person
yeah.
and get in there
where are you
because
located?
Let me look him
Richmond,
up.
Virginia.
Yeah,
Richmond. So there's
his name is Dr. James Cooley. He's in Midlothian.
Perfect.
yep.
Get on the phone with him
And
and get an appointment set immediately.
yeah, after this, like that was literally I didn't want to cut you off or anything, but I'm sitting here like, oh my goodness, like I almost went to the chiropractor last week and Dr. Buyback is you could look at it and you would be able to be like, "Oh, Riley." Yeah.
But I
So,
love the fact that your back's
You'll love
messed up,
James.
but it's probably something else that's out of alignment
mhm.
that was the tweaking point.
Yeah, I said you'll love James. All right, he's a really nice guy. He went to school out in California, took my course out in California, and then moved out there. All right, you'll love him. I know James well. All right,
Awesome. Yeah, I need help. I need relief. It started with me like turning my back when I was moving a shelf, and then it moved into my shoulders. Now it's in my lower back and past my tailbone. And yeah, it's been a little over 2 weeks now.
two things in support of your Dr. Tucker. Okay, there was a neurosurgeon years ago, and this is in the 70s, I think. He wrote a book, and the title of the book was um, Low Back and Leg Pain from a Herniated Cervical Disc. Okay, so that, all right. Not only that, I had one of my guys from Australia called me up and said, "You seem to be getting better results with this than I do." And I said, "Well, let's see you treat C7, which is the bottom vertebrae in the neck."
Mm-hmm. That's
And
what mine was.
yeah, this guy had lower back and leg pain. And I got him to put him against the wall and do C7 correctly. His hand was in the wrong place. I got him to put it in the right place. And the patient reported that immediately his leg pain stopped.
Yeah.
So your guy definitely accurate.
It was honestly, I'm telling you, man, it was such a lifesaver
Dawn, you might
because
should go too.
what's that?
You might should go as
Oh no, I'll
well.
definitely go. I'll definitely go. I mean, in the order of who's going to go first, you're higher priority because you're really messed up. But obviously, the goal is not to get messed up and to stay in alignment and get all this
Yes.
like adjustments made. Uh,
Well, that's a funny thing. Hang on, that's a funny
no,
thing.
not adjustments, corrections.
Yeah,
Excuse me.
correct. But that's a funny thing because every once in a while somebody says they're going on vacation and they've been through the program and they're doing good, and they come in and they say, or they call up and they say, "Doc, I'm going on vacation. I want you to see me one time before I go so you can do preventative stuff." And I have to tell them there is no preventative stuff. And they're like, "What do you mean?" I said, "Well, if you have bones out of place in a direction your body can't self-correct, it's not preventative. We need to correct them. But if you don't have any bones out of place in the direction the body can't self-correct, don't let anybody touch you." And then people are always asking about corrective exercise. And I can tell you, exercise is great. It makes you stronger. It helps you compensate and everything. But if it's bones out of place in a direction your body can't self-correct because there's no muscle pulling in the direction needed, there's no corrective exercise because nothing that you could do with your own body is going to correct the position.
Mhm.
So
So
also stuff like that.
like I said, we're going to have the website down below and in the description. If you want to take the course and learn this amazing information, you can do that. If you're in the United States or somewhere
You can join
you're
me.
looking for somebody that's gotten this training, you can go to the website and you can find them. And, doctor, we need to circle back maybe in like a month or 6 weeks after Riley's gone through all this and after we've kind of been able to do this and do a before and after and maybe talk to you again because I know there'll be a lot of questions on our YouTube channel. And maybe the next time we do it, we can do lives and maybe you can answer a few questions
That would be
from some of the
awesome.
people if that's good with you.
Absolutely. I have no problem with that. Riley, when you go, and you too, Sean, tell James you want front view and side view pictures before and after every visit.
Okay.
All right. And what you'll see is you'll be able to see how your body's unwinding. All
I
right.
I'm so excited.
I have to say, I have to throw this in there. When you did that, you stood up and said the body was out of alignment. That's part of the unwinding. That's part of a position that you need to stay in so that you can thoroughly unwind. Like that's
Yeah.
fascinating. Like that's really amazing. Like you
It
need
is.
to like slowly untwist,
Yeah.
but you can't just untwist it once. You have to
Yeah.
slowly adjust. Like that was actually that was, I mean, this call has been a great call,
It's so
doctor. I mean,
intriguing.
I've
I think
learned
it's
so
so
much, but
me too.
and so much of it makes sense, but
Yeah.
visually having a better understanding of the body, the pluses, the minuses, how you work with it, what all these different things can do. And I'm going to definitely follow up with Patrick Bain. If I got one thing out of this that I think will really be a game changer for people with muscular dystrophy or
No, no, not muscular dystrophy.
what
Muscular
was it?
dystrophy, multiple sclerosis.
Multiple sclerosis. Okay.
Yeah.
But also with the muscular dystrophy, does it help with trying to help stretch and flex?
Um, yeah, but muscular dystrophy is a different thing.
Okay.
That's a a genetic chemistry something or other, and it helps, but
That's when they just dissolve, isn't it? The
no, it's
We can
there's
save that for another call,
yeah.
but the multiple sclerosis, to just, and we get a lot of people in here. I mean, I'm just going to show you this real quick because I don't know, but those beds right there are the most high-end ICU beds that you're going to find, surgical tables. But that bed right there that you're looking at is a $90,000 bed, brand new. We sell them refurbished, and we deal with every day. We are in the wellness space, so we do wellness, but we're dealing every day with people for home care that are really messed up.
oh
And
yeah,
and they're coming to us for the beds, and I'm thinking, man, if you would just be open to listening to some other technology, and it's not even mine. Many times I'm referring them to go get technology from other companies that we don't even sell that I know would have benefit, and they just want the bed and just want to, they just want to do their thing. So when I hear about Patrick, being able to help people and a very small percentage follow through, I get that because I get that every day. And it is what it is, but still it's my responsibility in some sense to just put the knowledge out there. Everybody will have a way that they handle it, whether they pick it up and want to do it or don't. At least I've done my part as I presented the information, and then I'll let God and them and everybody else figure out if they want to pursue it or not. But that's really amazing that you have connections and have people like him that are kind of in your disciplic succession would probably be a
oh
nice
yeah.
way of saying it. So um, I'm gonna leave it there. But before we go, Riley, do you have any last words for Dr. Jesse?
Honestly, I think we pretty much covered everything, including all of my questions. I'm just, again, like Sean said, very grateful for what you do, and your ability to teach is wonderful and incredible. And wow, like the way that you explain stuff to just make it easy to understand,
Very
comprehend, and
easy.
teach other people. That's really how
I'm
we
going
should.
to give you something right now that's worth the entire time we talked. You know what it is?
Yeah. No,
All
what
right,
is it?
What?
Riley,
Yes.
go on the ABC website,
Okay.
watch the video,
Okay.
and punch Sean in the chest.
She'll punch me before she even watches it. I'm like,
No,
girl,
it's
we're
not.
going. We got chiropractic tables and massage tables all over this place
We
because
do
that's the
actually.
medical side. We have like 4 rooms with all that stuff, and she's
I,
gonna be busting me up real soon.
you almost don't need except for doing lumbars. You almost don't need a table. All right,
Oh my
but
word.
literally, if you put your fingers on the front of the collarbone, right where it attaches to the sternum, you have to hit up. Don't hit down. Hitting
Yeah,
down causes a problem with the second rib. You hit up, all right? And take pictures before and after. You'll be astonished at how much you guys straighten up.
amazing,
Wow.
amazing.
That's so
What a
incredible. This is
great
an
call.
You'll have
awesome
fun.
call.
You'll have lots of
So,
fun.
Dr. Jesse, I just number one, I want to say thank you, Riley, and I know you just did, but is there anything else you'd like to say before we end our first call today?
Oh,
Um, if people have questions, they can email me. And there's a couple places on the website where you can email me and you can ask the questions. But most of the time, the questions people are asking are going to be answered with find a local ABC practitioner and go ask them the questions. Because over the phone, all right, even over the internet here, I can tell some things, but without the person's body in front of me, there's a limit to what I can tell people.
I love that. Well, once again, it's
Right?
abcmiracles.com. There's going to be a link down below also, and we'll have more information on there. Dr. Jesse, thank you so much once
Thank
again
you.
for your time. What a great call. Very informative. And we'll keep you up to speed with Riley. We'll stay in touch, let you
Yes,
know how she's doing. We're going to go see, you said Dr. James is down in
James
Midlothian.
Cooley, yeah.
mhm.
We'll go see him and we'll both report back to you. And I can't wait to have you back
And
on
we'll have pictures.
for a future
There you go.
podcast. Yes.
Yep,
All right.
there
Thanks
you
Yeah.
go.
again. Take
All
care.
right. Nice
Thank you,
to meet you.
doctor.
Bye-bye.
Nice to
Bye-bye.
meet you.